Welcome everyone. Now I will talk about dyslipidemia in diabetics. And we all know that diabetic dyslipidemia is a very common problem, and dyslipidemia in diabetes can lead to various complications. And while we are talking about dyslipidemia, the main thing is cholesterol. Blood cholesterol is made by your liver and is also absorbed from foods we intake and to perform many important jobs like making hormones and digesting certain foods and also making many other important cellular components like cell membranes. The ideal LDL level, which is considered as the bad cholesterol, should be less than 100 milligram per DL. Triglycerides should be less than 150 milligram per DL, and good cholesterol, that is high density lipoprotein HDL, should be more than 40 milligram per DL for men, and for women it will be more than 50 milligram per DL. Whereas desirable is more than 60 milligram per DL for the both. Diabetes tends to lower HDL cholesterol levels and raise triglycerides and LDL cholesterol levels, which increases the risk for heart disease and stroke. Diabetic dyslipidemia is often characterized by elevated fasting and postprandial triglyceride levels and low HDL cholesterol levels, and there is elevated LDL. And these LDLs are characterized by predominance of small dense LDL particles. So diabetic dyslipidemia is a very important treatable risk factor to prevent further cardiovascular diseases and complications. Now, things we can do to improve our cholesterol levels are as follows. We can exercise for 150 minutes a week, like 30 minutes every day for 5 days in a week, and we can quit smoking, sleeping at least 7 to 8 hours each night, keeping your stress level well managed, increase fiber intake, like apples, bananas, oats, black beans, sprouts, etc. And we can increase healthy fats like fish, nuts, and seeds, like foods that contain unsaturated fatty acids like omega-3 and omega-6 fatty acids. They are good for our health, and we would try to avoid saturated fatty acids. Now, then we can decrease unhealthy fats like the thing I was talking about earlier, the whole milk, butter, stick, margarine, fried foods, and baked goods and pastries. So, if we can follow these guidelines and we can bring some changes in our lifestyle, people who are diabetic can prevent or treat diabetic dyslipidemia effectively, and also we can seek help from our physicians to take drugs that can reduce cholesterol levels. Thus, we can prevent many cardiovascular complications like coronary artery disease, peripheral vascular disease, diabetic retinopathy, and many other microvascular complications that are indirectly related to diabetic dyslipidemia. So, if you are a diabetic, you should do a lipid profile testing for minimum 1 to 2 times per year to track your cardiac health. Thank you.